skip. Screen sharing has stopped. Okay, move. Okay, sorry about that. When I was live streaming it to YouTube, it was back feeding me.
I figured it was something like that. It's very disconcerting.
Okay, let's go back to guest speaker. Sorry about that.
Yeah, no problem. So sorry about that, everybody. Like I said, it's an ad hoc committee and we are not live YouTube streamer experts here, but I'm excited the content's being recorded. So our guest speakers today, we have Michael Ward from the Edge, or Manufacturers Edge as it's more formally known, up in Denver, the state's representation for promoting manufacturing within the state of Colorado, and a great resource. And then we also have Tom Monaco, who is our rural opportunity representative from OEDIT, or the Office of Economic Development and International Trade, depending on whether you like acronyms or not. Emily, can you go back to the slide version if you can for the presentation? If not, it's okay.
Where are you? What do you have?
Just being
God dang it. It's different on my screen.
Yeah, that's the hard part with Zoom shares is you share a screen, and we were getting the slide, but then the not taking up the whole screen. So I think it's just. So I'm going to introduce our first speaker today, and that is Tracy Holcomb, who is the business liaison from San Juan Basin Public Health, and she is going to demystify Public Health Order 20-28. So welcome, Tracy.
Thanks, Betsy. I'm not sure that that's actually what I'm going to do, but I'm going to give you guys my best crack at it. Public Health Order 2028 is definitely a bear, and there is a lot of gray area in it for all businesses. But we're going to talk through the requirements for manufacturers today, and also just kind of some best practices around this. As Emily and Betsy mentioned, I work for San Juan Basin Health. In my current role, I'm the business liaison, so I'm working with businesses to try to help them reopen safely. I realize a lot of you guys have been open through this, but we're trying to help strike the balance between public health and reopening the economy, because that's where we all need to be right now. So let's get started. Next slide, please. So Public Health Order 2028 is, it starts with some general guidelines for all businesses, and then it goes into some sector specific guidelines. For all businesses, whether they've been open through this or whether they're just getting ready to reopen, employee health is a big component of it. So for all businesses, symptom monitoring, reporting anytime you have employees that have symptoms of COVID-19, or they show a temperature. Temperature checks are required for all businesses, including manufacturing businesses, although there was a revision that allows businesses to ask employees to take their temperatures at home. So you don't have to put this screening in place where you're screening them as they're coming in. It's a good practice, but it's not required. So you may be asked, though, to show temperature logs at some point if there's an outbreak at your facility. So it's good to have that record keeping in place. Cleaning and disinfecting of high touch areas, shared spaces, shared equipment. This is just best practice. Most businesses, most manufacturing facilities are doing this anyway, but with the outbreak of COVID-19, using the disinfectants that are indicated to be effective against that, and making sure you have these processes well documented is a great practice and a requirement for all businesses. Obviously, hand washing upon arrival and leaving. Best practice on this would be to have set times. So, during shifts, if you take a lunch break, if you have, bathroom breaks or whatever, to have an established protocol for when hand washing happens. And then maintaining the 6-foot separation between employees. And again, this is something that's across all sectors. And I understand that maybe there are some concerns around this for manufacturing. We can talk about that in just a second. Next slide, please. So the sector-specific guidance, this is all in Appendix H of the public health order. If you want to look at it yourself, it's the very end of the public health order. So you can just scroll through all 36 pages or whatever to get to the end if you'd like to see that. For manufacturing in particular, they're asking that you limit group interactions to less than 10 people. That doesn't mean that you can only have 10 people working in your facility at one time. It just means that your groups of people should be limited to 10. So you're not going to have an all staff meeting where you have all 150 of your employees in the same place at the same time. Modifying traffic flow to minimize contact. That would be similar to what grocery stores have done with one-way aisles. That's the example they use in the sector-specific guidance, is trying to make the flow of your facility work such that you minimize contacts between people passing each other. Whether you do that by zoning your factory or putting in directional flow, that's what they're asking for there. So the 6-foot distancing and impermeable barriers. So this is in the guidance, it says whenever possible. That leaves a lot up to interpretation. And you as a manufacturer or as the manager of your facility have to decide what whenever possible means to you. As you all know, enforcement around this is very undefined. So it is unlikely that, it is extremely unlikely that anyone from San Juan Basin Health is going to come into your facility and tell you that you need to put barriers up. But what you should be thinking about with these is, if you were to have an employee that became positive, that tested positive or came down with symptoms, have you put the practices in place that you can feel good about saying, we've done everything that's possible here? And so, of course, we could take this, to an extreme, which would make it impossible for you to operate. I don't think that's what anyone's asking for here. I think what we're asking for you to do is to put your glasses on around, how can I set my manufacturing facility up such that I minimize contact between workers, and I put as much barrier in place as possible to keep people safe. Limiting sharing of tools or equipment. If that's not possible, making sure that you're cleaning and sanitizing those. Ideally, each employee would have their own set of equipment and tools, and those would not be shared. If they are going to be shared across shifts, making sure that there's time where those are cleaned and disinfected before the next shift begins using them. Daily and between shifts, deep clean and sanitize. That ideally is also factory or manufacturing floor. Using electronic options when possible. So these would be like, contactless entry, getting rid of doorknobs if possible. Instead of having paperwork, having things be electronic as much as possible. A lot of this is stuff that's coming in to your facility, so shipping and receiving. If you can make that as low contact as possible, that's what we're talking about when we say electronic options. Face coverings are required unless harmful to health. So again, that's one of those gray areas where you get to decide what it means for something to be harmful to your health. In light of the city council last night passing or asking city staff to develop a mandatory face covering order, that may make this even more important to your facility or more required. I think that you should be prepared as a manufacturer to make the case why face coverings would be harmful to health in your manufacturing facility if you're going to go that route. But honestly, our best options are social distancing and face coverings for preventing transmission. So I would say anytime, if you're going to use those exceptions around wherever possible or harmful to health, you should be prepared to make a pretty solid argument around why those apply to your facility. Next slide, please. So continuing on with the manufacturing specific guidance, staggering breaks and lunches, thinking about ways where you can keep groups to less than 10, and even specifically where you can keep the same groups of 10 together. So, the last thing you want is to do a great job of keeping all of your employees socially distanced and wearing face coverings and all of those things when they're working. And then everybody takes a break and goes outside together, or goes to a break room together. And that becomes your place where transmission happens. So, thinking through that, prohibiting all non-essential visitors, and also requiring all visitors to abide by the same rules you have for your employees. So if you are allowing visitors into your facility, requiring them to wear face coverings, requiring them to follow your same symptom checks that you do for your employees. And then lastly on this one is maintaining social distancing in shipping areas. So one thing that happens is we get really good at putting the procedures in place for our regular operations and for how our staff follows and our workers follow the guidelines. But then when we have situations where we have shipping and receiving activities, or we have visitors in our facility, we haven't really thought all the way through those protocols. So in this sector specific guidance, what they're saying is make sure that you're applying your rules that you put all this thought into to everyone who's entering your facility, whatever their reason might be. Next slide, please. So that's kind of, those are the main points of the sector specific guidance. And, I'll answer your questions around that as best I can. When I was talking to Emily yesterday, one of the things that came up was ideas around some best practices that maybe aren't specifically spelled out in the guidance. One thing I've already alluded to is organizing your workforce into teams that stay together. And I know that this may not be possible for all of you because you all have different, different ways that you work and different processes. But the reason we're saying that is because if one person in your facility comes down positive, we're going to want to try to isolate or quarantine all of the people that they've worked closely with. So if that's a small group of people, it's going to mean the smallest impact to your facility. If everybody is kind of all intermingling together, then that becomes harder to isolate the people who may have potentially been exposed. So this is really a practice that allows you to make sure that your manufacturing operations can continue if you were to have an outbreak in your facility. Another thing that we've been talking to businesses and other facilities around is ventilation. So we know that transmission is much higher in indoor spaces than outdoor spaces. The more we can increase ventilation, either through fans and mechanical ventilation, or even just opening doors and windows, that's going to do a lot to reduce transmission within your facility. Zoning your factory floors, so having areas where one type of activity is performed and you keep all of the employees that do that type of activity in one area, and kind of splitting your facility into chunks. It kind of goes along with organizing your workforce, but that's a great way to kind of, really all we're trying to do is make sure that if one person comes down positive, we can kind of keep that segregated. So a physical zoning of your factory will help with that also. Minimizing shift handoff meetings. So some of you may have, one shift leaves, they do a handoff to the next shift. If you can eliminate those, or if you can make them such that one member of your team is coordinating with one member of the next team, that's going to minimize the opportunity for transmission to happen. So using representatives for things like that. And then the last thing is a shameless plug for a worksite monitoring program that we're getting off the ground, which will do diagnostic testing for COVID-19 among your workforce. So you can go ahead and go to the next slide. I think I might have put a slide in on this. Yeah, there we go. So what this does is diagnostic testing for COVID-19. It lets us identify people in your workforce that may have been infected but aren't showing symptoms, or maybe they're not showing symptoms yet. And so if we can identify those people early, we can keep them from infecting 2, 3, 4, 10, 12 other people within your facility. This allows us to get those people into quarantine before there's an outbreak at your facility. So that's the goal of that. It's especially important in facilities. So the highest tier businesses that we're working with on this are businesses that either have stayed open through this and they've had high public contact, which is probably not you, or businesses that are unable to keep social distancing and or face coverings in place 100% of the time, which may be some of you. So we're just getting this off the ground, but we've gotten a few businesses and a few facilities already going with this. We can come onto your site, we can do this testing. It's been covered by insurance in a lot of cases, and in cases where you have employees that are not covered by your insurance, we have the ability to get testing at no cost for them. So really what we're trying to do here is make it so that as we begin reopening other businesses that were not open through this, and tourism starts to increase and more people are out, that we have a little bit of an early warning system if we're starting to see an increase in infection. So that helps our whole community, but as your business, it also helps your business keep from taking down the whole team if you get one person who's positive. So I'm going to shut up now and take questions. I understand that there might be some, and I will do my best to answer them. If I can't answer them, then I will take them back to the guys at San Juan Basin Health and try to get back to you with answers. So.
Thank you, Tracy. That was great information. Emily, did you retrieve any questions for Tracy?
So far, I have no questions coming in, but Tracy, if you could hang out for about 10 minutes in case someone, or 5 minutes in case someone has a question regarding this, that would be awesome.
And
can I ask a question? Hello?
I did just get one question come through, which was, if you could put your question in chat, Nancy, that would be great. I will ask the question that came through chat and then we'll ask yours. So on-site testing, how is it deployed?
So we have a partnership with Cedar Diagnostics, and they will, what we do is we ask the employer to get a list of employees that want to be tested, or a list of employees that are going to be tested ahead of time. And then Cedar Diagnostics sends a team on site. It takes less than 2 minutes per test. All of the results from those tests go right back to the employee. They do not go to the employer. So privacy is 100% respected there. I will say, however, that it is a mandatory report to San Juan Basin Health if a test comes back positive. The lab will report that to us and we will initiate contact tracing from there, but the employer will not be notified. Employees are supposed to notify their employer if they have a positive test, but we've had a lot of concern. I just want to be clear that we're not getting those results and telling your employer about it. We're using it as, if the contact tracing, if you have been working in close contact with other employees, your identity will be protected. It will not be disclosed, but we can do contact tracing anyway. So.
I do have 2 questions coming in. One is self-certification required by the manufacturers, and by what certain date?
Yeah, so self-certification for all businesses, even if you were operating through the closure, is required. I was looking at the self-certification form yesterday because there is not a category for essential manufacturing on the self-certification form. And so I asked that question, which category you guys should certify as, and I was told critical retail is the category that we want manufacturing to self-certify under. The self-certification process just says that you have read and you understand the guidance. And it lets us know that, and so what happens if you don't self-certify? You'll get a call at some point from someone at San Juan Basin Health saying, are you aware of the guidance around the public health order? And do you need help implementing it? Do you need help understanding it? So we are asking all businesses self-certify, even if you maintained operation all the way through.
Okay, and the next question is regarding your diagnostic testing. How often does the testing occur? Also, how are other manufacturers dealing with employees who rip off their masks the minute there's no manager on site? Good question, Nancy.
Well, I can answer easily the question, how often does the testing occur? So what we're doing is we're doing a baseline test as soon as, we had some that started last week, we have some happening this week. We're getting those scheduled within 3 to 5 days of, getting it set up with each business. And then what we're doing is we're retesting at 14 to 28 days later. So right now, we are not considering this to be ongoing testing, but there could be a scenario. And here's why, because we've had a lot of people out interacting. I mean, we don't know what our baseline is. So we've had a lot of people interacting with different groups of people. We don't know kind of where we are right now. So what we're looking for is, let's do an initial round of testing and see where we are. Let's see what that positivity rate is. And then let's see where it goes. And so as we begin reopening all these other businesses, if that positivity rate stays the same, we know that we can continue doing what we're doing. If we see a sharp spike somewhere, then we need to look at, where is it coming from? What sectors is it coming from? What can we do to mitigate those risks? So right now the program includes an initial test, and it includes a follow-up test 14 to 28 days later. And as you all know, everything changes pretty much every few days or every week with this right now. And so we're going to just kind of continue rolling with it. As far as what to do when employees rip off their masks, some of you guys on this call might be better able to answer that than I am. I guess my one thought would be, if they are ripping their masks off, my hope would be that some education and understanding what's at stake for them would be a good first step, but that is not my area of expertise.
So I would like to entertain to any manufacturers, if you are having this issue or you have dealt with this issue, if you could put some feedback in the chat. And then one other question for you, Tracy, is will the testing be the swab testing or the antibody testing?
Right, that's a great question, and it's one that we get a lot. So right now, the swab testing, the PCR testing, is the only test that is diagnostic for COVID-19. The antibody testing is interesting as a curiosity, but the information that we gather from that doesn't really, it's not deemed to be reliable enough, and it doesn't really tell us what we need to know as far as, is COVID-19 present. It is also not covered under any type of insurance or state program that would cover costs for testing. So if you want antibody testing, it's got to happen out of pocket. And what you do with that information is still, nobody's really figured out how we can use that at this point.
Okay, any other questions out there for Tracy before we move on?
Sorry, I did have one comment on the removing masks. Someone weighed in and said, several companies on the Front Range have swift termination policies due to endangerment of other employees. They're taking it very seriously. The nature of what we have to cover today, we can't get into too much HRE stuff, but we could certainly take that offline, anybody who's interested. So Tracy, thank you for all the great information. I'm sure there'll be some more follow-up questions, but we don't want to keep you on the call forever. We know you have a lot to do. So we're going to keep moving through our agenda today. Thanks again. And I'm going to do a very turbocharged overview of the Families First Coronavirus Response Act, or FFCRA for short, or as someone within my organization threw up their hands and said, I can't handle any more acronyms, I'm going to call it the COVID FMLA. But what I wanted to do today was just heighten your awareness of it, because if you think it doesn't apply to your company, you might be wrong. And I just want everyone to be acutely aware of that. So next slide, please, Emily. Next slide. There's my pretty little virus. I actually think it's kind of pretty. I don't know if that makes me a weird person, but there's a lot of beautiful images of COVID-19 on the web. So this is a new act that went into place on April 1st. It was part of the federal stimulus package. Many of you heard about the CARES Act, which extended unemployment benefits, made them more generous right now, because many of us have had to lay off people, unfortunately. But for those of us who are trying to maintain our employees, there's also some new extra rich benefits available. And so they expanded benefits that they're not quite part of the FMLA, but they dovetail with the Family and Medical Leave Act. Okay, so this was effective April 1st. It's not retroactive, and it affects all private sector employers who have fewer than 500 employees. And that may come as a surprise because the FMLA only applies if you have 50 or more. So very small businesses can take advantage of this new act or be caught out by it if they're not paying attention. It has two main provisions to it. There's an emergency paid sick leave provision, and there's an extended family medical leave provision. And the two are not mutually exclusive, but they can dovetail depending on circumstances. There is a posting requirement. And so I want to make you aware that the end of this slideshow, Emily has curated all our nice resources and hyperlinks. And so you will have access to links to all of the things I'm discussing. So, so rest assured you'll have this poster within minutes if you want it. So there's a posting requirement. You're required to put it where you would put all your other workplace notices. And if you have workers who are not physically on site right now, you can take care of your posting requirement by emailing them the notice. It's a simple one-page document. We're going to look at it in just a moment here. And it does line out the provisions. There are 6 qualifying reasons why one of your employees might have this leave available to them. And here's, if you're going, oh no, one more law for me to comply with. This is, I like to think of it as a win-win situation for many employees. You are getting a dollar for dollar tax credit for any paid leave that you apply that qualifies under this new FFCRA. Next slide, please. So like I said, this could be win-win for you and your employees. If you, this is not, if you have to lay people off, you have to lay people off. But these are people that you are retaining on your payroll and who may qualify. And it's one more mechanism that you can help them keep their cash flow going at a time when they most need it. And so again, you do the right thing for them, and you as an employer are getting a tax credit. I do like to point out, I am neither a tax advisor nor an attorney. You should consult with your appropriate resources for your organization to make sure that if you are applying FFCRA credits to your tax burden, that you aren't double dipping. So all of the stimulus package was designed pretty carefully to avoid double dipping. What do I mean by that? Well, maybe you took out a payroll protection loan, you know, the PPP, or some other form of government aid that's currently available. If you are claiming wages to apply for PPP loan forgiveness, for example, you can't then also use those same wages and get a tax credit under the FFCRA. So work with your tax advisor if that applies to you, and make sure that you're proceeding with caution. But do not walk away from this act just because it might be a little bit of a complicated tax situation. It really is a helpful act. Next slide, please, Emily. So this is the poster itself that is from the Department of Labor, and it lines out the 6 reasons why someone might be entitled to FFCRA leave. And again, this could be for a very small employer. And I'm not an expert on this topic, but it could even include self-employment and other workers that might traditionally be excluded from these types of stimulus packages. So there are 6 reasons lined out here. And the ones that I think are probably the most common in La Plata County right now would be someone who thinks they might have COVID and is actively seeking medical diagnosis. You can't just self-select, I want FFCRA because I have some COVID symptoms and I want to stay home for 2 weeks. But if you say I'm under a doctor's care and my doctor agrees that I might have COVID and I'm going to be tested, then the FFCRA would apply. if you have, this is also key, this is what we've done the most of at Stone Age, is we have actually applied it for people who have young children at home and are unable to do their full-time duties that are assigned to them because of taking care of young children and dealing with the fact that the schools and daycares are closed. So the real hardship that is posed for parents during this time is not something we want to shirk away from. I think that this is a really great way to support families and to support, and we have a number of single parents who are able to take advantage of it. There are lots of situations where this can apply. So there are steps to the process. The employee actually should request the leave. You should review it, and then you can approve it or reject it if it doesn't. There are certain reasons where you could reject it. And then if it does apply, you would then apply that tax credit to your Social Security taxes, the employer taxes, not the employee taxes. There's also a Medicare credit. So again, that's where you would work with your tax person to make sure you're getting the full credit that is due to you. So the emergency medical leave allows for up to 80 weeks of paid leave at 100% of pay. I'm not 80 weeks, that would be great. 80 hours, ouch. 80 hours of paid leave at 100% of the normal pay rate up to a certain cap, $511 a day, which most people are not making anyway. And then the extended family medical leave allows for up to 12 weeks of leave. The first 2 weeks are unpaid, but the emergency paid sick leave can actually kick in for the first 2 weeks while you're waiting for the benefit to kick in under the extended family medical leave. Super confusing, I know, but you can be out for up to 12 weeks at 2/3 of your normal pay if you have a child at home that you're caring for due to the school or daycare being closed due to COVID-19. So all of these reasons are tightly tied to COVID-19. They're not arbitrary, and they are available to you. April 1st, and then right now they're due to sunset on December 31st. So we'll see if they become extended or not. So next slide, Emily. Because these will be at the end as well, but because the DOL didn't issue model notices, they issued the poster, and that's a link right there. But a lot of other groups have created model notices for our use. So I pulled the ones from our own insurance broker, IMA, and they have model notices available at that link. They have a model policy you can issue. They have a model form for the employee to request this leave, and they have model response form. And then I love this DOL page with the FFCRA Q&A. It has, I think, 93 different questions that have come up that they have answered, which, you know, it's beyond the scope of this webinar to answer nuanced questions, but this site page probably has what you're looking for. All right, I see that I had a question come up. That's all I have on right now. I know it could be an hour-long topic. Someone said, I assume if we need to use the FMLA benefit and our PPP loan has expired, then it's easy to distinguish the two benefits. Yes, I would imagine so. And for those of you to whom FMLA, the regular FMLA, not the COVID FMLA applies, these are not two separate 12-week allowances for employees. It is a, they run concurrently. This runs concurrently with regular FMLA. Any other questions on that? Okay, I'd like to introduce our next speaker, and that is the amazing Ryan Finnegan, who is the owner of Carbon Design and the director of the Maker Lab. And he is up.
Hi, everyone. Thank you for joining. So yeah, I wanted to talk briefly. I'm not going to go through the survey results in detail, just take a little too long. But what I'm going to do here is I'm gonna, in the chat, just drop the link to them so everyone can feel free to look that over if they're curious or interested, and if there's any questions at the end, feel free to ask. So just a couple of them that I wanted to discuss. First of all, I want to thank everyone for taking the time to do the survey too for us. Really, that was, as Betsy mentioned, an opportunity for us to get to know kind of the workplace environments and the challenges that everyone feels like they may be facing. Manufacturing, tech and industry, our subgroup. It's a pretty diverse set of different working conditions and challenges that you guys might face. So we wanted to really understand how we could be of greatest service. One that was a special interest to me, as some of you know, with the PPE work that we were doing to support the local medical community. And we are transitioning into a kind of phase 2 and actually out of Maker Lab into its own organization that I'll be running. And it'll be largely to help support business community also in acquiring PPE. So that was one that it looks like about 56% of you guys feel you're set for now. We are anticipating moving forward into the future that there could be some major acquisition issues with supply chain problems, especially, as you guys saw the order for the city to mandate face masks and things like that. So now we have even a more increased demand for already a struggling supply chain. So we're hoping to just coordinate with everyone, understand where people's needs are with that, and other things that might be required, both, just in general supplies too. I'm definitely anticipating some pretty major supply chain problems with disinfectants and hand sanitizer as the entirety of the world opens up, or the entirety of the United States opens up, and everyone's got to be disinfecting every surface every 2 hours. So we're hoping on coordinating and potentially getting groups together, and even in this subcommittee or the subsector group, and doing bulk purchasing, trying to understand exactly what the needs are across the sector. And it's sometimes easier these days to buy a 5-gallon drum of hand sanitizer than it is a little squirt bottle. So there's possibility we might be able to get together and pitch in and make larger orders once we understand total need and things like that. So yeah, we are, so one of the questions that we asked too was if anyone was interested in potentially putting together a coalition. So that comes off this last point, and participating in that. So possibly a monthly meetup, and we can help facilitate that and get everyone together discussing strategies, techniques, kind of some of the stuff that comes out of a webinar like this, and, some of the questions about what to do about employees not in compliance and things like that. And, just exchanging information, potentially coordinating on these purchases. Some of the larger businesses, if you have assets, being able to help some of the smaller businesses. And we're also curious about, we're about 50% of the businesses, or actually a little bit over, I think it was 60-some%, said that they'd be willing to potentially help in distributed manufacturing too. So if we do run into a couple supply chain problems, and we are excited that there was that kind of interest. So I'll continue to coordinate with you guys on that. We do have thermometers that were purchased by Bake San Juan's, and they are over at La Plata Economic Development Alliance. And if you need one for your workplace, reach out to me. That'll give me an opportunity just to kind of further understand some supply and PPE needs you might have, and I'll help coordinate getting those to you.
Thank you, Ryan.
Yep.
Appreciate, Ryan was huge in getting all those survey results compiled and turning it into a usable form. And I think Emily personally drove a bunch of those thermometers around to people, but if you didn't get yours yet, please do jump on board. That was really kind of Bank of the San Juans. We're very grateful to them. And if anyone has questions for Ryan, type them into chat quickly. because we are going to move on to our next speaker, who is.
There was one question that came in for you a little bit late. Can you require employees to use paid time off or sick time before this kicks in, before the FMLA kicks in?
Yeah, so I don't want to say I have total authority on that, but my understanding is no, you can't any more than you could with regular FMLA, but you can, if you spend 2/3 of the pay, apply their PTO to the remaining 1/3 of their pay to bring them up to whole pay and use it in that manner. I do think the DOL page that I referenced does address that in more detail though. So don't take me as the ultimate authority, but check out that question and answer page. You can actually, if you do have an employee at 2/3 pay, you can elect to pay them more. If you're feeling generous, you can pay them their full paycheck. It's only 2/3 of it that you would get credit for, by the way. So Michael Ward is the Regional Director with Manufacturer's Edge, and he's going to talk about this very cool recovery planning and implementation tool that they have come up with. So welcome, Michael.
Thank you very much. I appreciate that. And let me first say thanks again for the invite. This particular area of the region that I'm involved with always seems to have very innovative responses to any of the challenges that we have. And so I'm always excited to be a part of it. I've got a presentation here that quite honestly is not going to take 10 minutes, but I do want to highlight a couple of just anecdotal evidence that within the state of Colorado, especially this region, we have seen just a tremendous response from manufacturers, essential and non-essential, and their abilities to contribute to the good news portion of this pandemic. And what I mean by that is we've had manufacturers volunteering without our help in pivoting for the good of their local communities in getting resources and making items that are in demand. We've all seen those stories, face masks and so forth. One in particular I want to point out, we had a sewing operation that unfortunately was shut down due to COVID. Managed to land a contract with Denver Health, a medical center, in repairing gowns. And this particular contract has kept this company afloat over the last few weeks. And in turn, it's kept our medical and first responders on the front lines with the necessary protective gear that they need. So it's been a win-win. And I illustrate that because of I'm just so proud to be involved with all of you on this call. Some of you I have met and some of you not, but I hope to at one point. So as Tracy mentioned earlier, Emily, can you throw up the next slide? As Tracy mentioned earlier, there is an exhaustive approach with our Health Order 2028. And certainly we're not going to talk to every single requirement. But what we do offer with Manufacturer's Edge is a prescriptive how-to, and we'll learn a little bit more about that as we go. Quick disclaimer here, very similar to Betsy's. We're not attorneys, we're not law enforcement, we're not CPAs, and we're certainly not first responders. So take the information here that you find valuable and use it. And if not, share it with someone who might. Next slide, please. Where we are giving guidance or helping folks from a very high level, we want to ensure local compliance with all federal, state, and local requirements. And we're going to talk specifically about the Health Order 2028, and more importantly, for the manufacturers and the prescriptive nature of the guides that we have distributed, not just to Emily, but to groups in your area. We have them available on our website, and they come across as PDF copies of a quick start guide found via our COVID-19 tab on our website, in addition to a part 1 and part 2 prescriptive how-to of what kinds of things do we need to look for. So as we go through these slides, a lot of it's going to be repeated from what Tracy has presented earlier, which was really good, by the way. I took away some things from her presentation as well. But what I would challenge you guys to do is to look at this from a lens of some of the underlying challenges that COVID has brought to the forefront. And that is what are we doing on a daily basis for risk management anyway, without COVID? What do our business continuity and disaster recovery procedures or policies already say, and where might they have been short in not covering some of the things that COVID has required? Lastly, workplace organization and employee safety, certainly the latter being the most paramount of all of the things that we're going to talk to, which makes it essential for each one of you guys to have some sort of plan to review what you're currently doing, create that assessment or audit internally, and implement the changes necessary so that your employees are covered, your workplace is safe, and that you can continue operations that are profitable and necessary for your strategy. Next slide, please. Thank you. So again, this is going to be something that's a rehash of what Tracy had presented earlier. But again, looking through it from a different lens, start thinking about your current supply chain risk and exposure with your vendors as well as your customers. That's okay, you can keep going because we're going to flip through these pretty quick. The big one is at the end. And again, some of these high exposure points. What we have found is easy identification by all of our clients and folks who are not our clients of what these high exposure points are or could be. But they're finding it difficult to implement some prescriptive policy or procedure to help mitigate that. And that's kind of where I think we can come in and help the best. Next slide, please. There we go. Facilities. This actually came up a few times, especially from the uniform collection standpoint. We actually had a couple of folks go away from uniforms because they deemed it too heavy of a risk in that if there was exposure, they didn't have to rely on their current laundry facilities to remove that, and they just weren't satisfied with that particular policy. So they ditched it, and for the meantime, those uniforms are not applicable. It's a kind of interesting little thing. Engineering controls, we saw this, Tracy mentioned this earlier, HVAC, all of your filtering that you do throughout your facility, the separation between work cells and so forth. That's become actually that's become a huge need. New filters, more filters. We're starting to see that hit the high item visibility list. Let's go ahead to the next slide. So the big takeaways here, I mentioned the documents that are available via our website. I believe Emily has also made them available locally as well. But the first thing is a plan. It could be your plan. We can help you with the plan. You have many local resources to help you with that. Second is communication and training of that plan. To all of your employees, all of your partners, your affiliates, and the people who are involved in your supply chain. Oversight of that plan and the changes to it and the modifications that you need to make based on what the environment dictates. We're not there, so we don't know. It's your company, your employees, you know better than we do. And then lastly is some institution of a regular audit plan as to whether or not the policies and procedures you have implemented are adhered to and they're actually making a difference. And then of those policies and procedures, some insight as to what can you utilize to move forward with and help your company mitigate future exposure. I hope I said that right. That sounded kind of weird. Anyway, I think we've got one last slide. Yes, my favorite one, need for help. And I know Tom's going to talk about some interesting ways of helping you get the resources that you need. But when we talk about the implementation, the plan, the auditing, the prescription, how-tos, we want to help. We want to be a resource. We want you guys to email us, to call us and say, hey, we need somebody on site that can just give us a second set of eyes on our plan. And that's available at no cost in most cases. It's typically up to 4 hours, but we're hoping that folks take advantage of that opportunity with Manufacturer's Edge. So there's my contact information. Please give me a call. Please email me. If anything, just tell us something cool and nifty that you're doing that other people might benefit from. So that's my 10 minutes. I hope they didn't run too long. I am ready for questions.
Thank you, Michael. If you have questions, please type them in chat now. And if not, we can answer. If you don't have time to type them in right away, we can answer them at the end of the presentation as well. So many good resources there on the Edge's site. So thank you for putting all that together. It's a huge asset for all of us. And the free consulting is particularly appealing right now. So thank you. And so our last speaker today, if you, I don't see any questions come through unless Emily has some sent to her. Okay, so our last speaker today will be Tom Monaco, who is the Rural Opportunity Representative from the Office of Economic Development and International Trade. So welcome, Tom, and thanks for being here.
Awesome, thank you. I appreciate the invitation to come and speak. So I'm going to talk just a little bit about sort of a high level process because I think at the end of the day, everybody's looking for money. You know, I think that almost all of it, doesn't matter what type of business you have, you're being impacted. And so what happens is that people sort of get a little bit desperate about finding and make sure they're not, you know, that fear of missing out. Like I'm not getting my, you know, I'm not getting the funds, I'm not taking advantage of the programs. And when you start to look at the landscape, especially for manufacturers or small businesses, there's a lot out there. Now, a lot of it is not new. A lot of it is existing programs that sometimes people just aren't aware of. We'll start at the high level. We've got the SBA programs, which are the ones that most people are familiar with: payroll protection program, economic injury disaster loans, express bridge loans. Those are the ones that get a lot of the press. Sorry, my clock's dinging in the background. And what we're finding though with a lot of those programs is they're not necessarily a good fit for a lot of smaller businesses. The programs are, I hate to say it, they weren't necessarily designed with the businesses in mind. And that's sort of an unfortunate reality. We're hoping that some of these programs are going to get modified to be a little more practical. And so a lot of times when the business looks at these programs, they realize, especially things like payroll protection, it's not always a good fit with your business. And so the first thing that I try to say to somebody who is looking, I'm looking for funding resources, I'm looking for access to capital. Just like Michael just said, you need to have a plan. You need to clearly identify what your needs are. What is it that your business is looking for? What is your capacity for debt? Am I just looking for grants? What is the outlook for my business over the next 6 months to 2 to 3 years? Because that's going to have a really big impact on my strategy as far as what types of funding I'm going to go look for. Payroll protection program, it's great if you can get it forgiven, but if you don't get it forgiven, you're saddled with that as debt. Is that something you can take on? Even at 1%, the amortization of that loan over 2 years, or essentially 18 months because of the 6 months of deferment, can end up being some pretty brutal payments that people are like, I'm not going to have the capacity to pay this back, especially when I don't even know what my outlook looks like for income over the next year. So having a really good sense of what your needs are is critical before you start chasing the funding. Because if you don't, you may end up digging yourself in a worse hole than you were by not going after that funding. We're seeing a lot, one of the things I've been doing for the past month and a half is I sit on the hotline for the state to help small businesses navigate some of these programs. And we're seeing a lot of instances where bad record keeping, accounting practices that are not necessarily illegal, but maybe are not, the best choices are coming back to haunt businesses when they are trying to go for these programs. And so making sure that, have all your ducks in a row, have all of your bookkeeping, make sure you have your taxes updated. A lot of people are running the problem that they haven't filed taxes this year. So they're relying on taxes from the year prior, and that may not be reflective of the reality of their business as it is right now. And so again, those types of things can become incredibly challenging when you're looking for funding. So, really make sure that you understand, what does your documentation look like? What is your relationship with your lenders? Have a strategic plan as you go into this process to look for funding. The next thing is, what is the return on that investment? So a lot of programs out there, and there are a ton of programs. Is it worth the effort for me to go after these funds? Is it going to actually solve my problem? Or, what is my, I said, return on that investment, the effort that I'm going to put into this, and is this where I am best putting my energy? So when you look at what it's going to take for something, especially when it comes to the grant programs, they can be pretty exhaustive as far as what it takes to jump through all those hoops. And the amount of money that you may get out of that, you may have been better off putting that energy into something else. So just be able to look at things objectively to see, is this where I should be putting my energy? Is this going to put me in the position I need to be in financially before I start going down that road? There are a lot of businesses that are not going to be of a threshold as far as their company size. Maybe their earnings, number of employees, different programs are going to be better suited to different types of companies. So very, very small companies are not necessarily going to be as competitive, or it's not going to make as much sense for a lot of these programs. We see that particularly with the payroll protection program. That's a program that if you're a very, very small business, it can be a program that really isn't a very good fit. Whereas a company where you've got 15 to 20 employees, it can make a lot of sense. So being able to identify where your company sits size-wise to go after some of these programs. So being systematic about it is really important. And then of course, the thing is, where do I find these programs? Where do I go look for this information? I know Manufacturer's Edge, you guys have a program that we just saw last week for a COVID-19 emergency response program. That it looks like an excellent program that is really tailored to all sizes of business. we see programs that are coming out mostly at the regional level. I know that Region 9 had a COVID program out there, and I'm not sure if it's still open. I think it was in April, but it was up to $10,000. And it was a disaster assistance program. Now, again, $10,000 may be perfect, or it may be a drop in the bucket, based on your need. So are you going to chase after 10 programs that are each going to give you $10,000, or are you going to go after one program that's going to get you $100,000, $150,000 and solve all your problems in one fell swoop? And again, it comes back to the bookkeeping. A lot of these programs have accountability to them. So being able to record keep and track all that information is going to cost time and money for your business. So you want to make sure that it makes sense for you to do that. On our website, which is choosecolorado.com, we have an alternative funding resource page. And it's basically a very cumbersome spreadsheet of what we call business alternative funding. There's probably about 180 different programs on there, and you got to dig through it. Some of them are county specific, some of them are industry specific. And the thing is, but it's worth going through there, because you may find that it can be anything from a deferment to a loan program to a grant. And so taking a half an hour to dig through that and identify what is going to be applicable for La Plata County, what is going to be applicable for my business, what is the funding threshold, what are the requirements. Those are the kind of things you're going to have to dig through and look at. I know First Southwest just came out with a new program. They have a COVID-19 Rapid Response and Recovery Loan Fund, which is up to $100,000, with a 7-year loan, which might be a perfect fit for some businesses, and then again, not for others. I think the biggest thing we're looking at is that, and I think a lot of you know this, that access to capital as far as the funding, there's plenty of money out there. What we're seeing is now there's more money out there, but it hasn't necessarily changed the game as far as your ability to access that capital. So depending on what your financial situation is, if the lenders are not changing the criteria, if there's not being exemptions made to what it takes to access that capital, it doesn't really do you any good. And we see in a lot of business, like I don't need any more debt. I need immediate relief through grant programs, things like that. And so we're hoping that as we try to pass that along, because we see a lot of that hopefully we'll see some more programs come in, especially things like commercial rent assistance. Those types of programs are where we're seeing a definite need from small businesses, because that's some of their biggest burdens, where they're like, we're not having any income, but we're still saddled with all of these obligations on the other end. So, my advice is, as I said, at a very high level, is really put some time into figuring out, identifying your needs and identifying the outlook of your business. Because what you don't want to do is you don't want to end up putting yourself in a worse situation than actually helping your business move forward. Questions? I kind of rushed through that quick, but.
Yeah, if you have questions, please type them in the chat. And also, if you have any other general questions, Tom is our last speaker, so at this point we can field any questions related to any of the topics as time permits, but we'd like to prioritize questions for Tom and first. And then Emily's put together this nice list of links and also email addresses so that you can contact any of us individually if you wanted to follow up on our topics today. We really do want to know what is of most benefit to you, our local manufacturing community, and how we can continue to move forward together. So go ahead and express that in the comments if you are able to, or send us messages afterwards.
Also, I want to bring to highlight the southwestcoda.org/industry. That's where you can find all the most recent documentation we can find of resources to help manufacturers. This will be our landing page. And as we evolve into a full operation and business as usual to the norm, whatever that's going to look like, you can find all the resources right here. We will have a link to this PowerPoint and to the documents that Manufacturer's Edge was leading to. We will send that out this afternoon. It's in our Google Docs, but we'll send you the link to that.
I did have a question come up for Tom, which is what are the current COVID grant guidelines?
For which grant?
I think the one you were talking about earlier, the local one, but I'm not sure. Maybe Michael can.
So I think the only, I know that I mean, the Manufacturer's Edge grant.
It's the CFEI.
The skill advance, Tom, the one that has a really short suspense. Are you, let me speak to it if I may really quick,
Yeah,
just for
please
the
do.
interest of the group. Through obviously through OEDIT and the current Colorado First and existing industry grant tool, they have extended a temporary grant period that is from now until June 30th. And the guidelines are, or the guide is capped at $45,000 per application for training and learnings necessitated by the COVID-19 impact to businesses and manufacturers in the state of Colorado. And that link to that information certainly can be found through OEDIT, can be found through our site as well, through Manufacturer's Edge, or you can just reach out to me directly and I'd be happy to answer questions and see if I can help you qualify.
And that's the emergency response grant, correct?
Yeah, sorry, I didn't get the name right, but yes, you are correct.
Okay, cool.
And I'd just like to say too, I definitely highly recommend reaching out to Michael. He's a wonderful human being, and I think he'll be a huge help to many businesses, and he has a really good understanding of everything that's available too. And I'm sure Tom also. There's so many assets that we have here. And Nancy Zimmer and Mary Shepard at SBDC too. They can all help and assist in those types of things too.
And one of the things that we can help with too is a lot of times when it gets challenging is when you start to combine programs, especially with SBA programs and other things, is how do these programs dovetail together? You know, if I have a PPP loan and I'm trying to navigate my EIDL loan, or I'm looking at an EIDL advance, you know, how do those fit together? How does that affect me for my forgiveness on the PPP? And then if you start to throw in some of these other programs, you know, it can change your financial situation. And so sometimes that can be one of the biggest things, is figuring out how these programs work together. And so we're always happy to try to work through on an individual basis. You can feel free to reach out to me. And we can help you kind of navigate those programs to say, you know, which ones naturally align and which ones are kind of oil and water.
Okay, I don't see any more questions that have come through, but hopefully by now you know how to find all of us. And I wanted to thank everyone for coming today, and to the local community for adapting and flexing in so many incredible ways to help each other out. So to everyone who's here, you're part of that, and we appreciate you, and we're here for you. So let us know your concerns, and we may not have every resource you need, but we will at least try to curate them for you and share that information. Emily, is there anything else you wanted to add about the Southwest Coda or any other?
Is there any pressing issues that anyone is fighting right now that could use a caliber of other manufacturers to help you solve? Great, that means everything is running perfectly